You're listening to the Beyond Measurements and Image podcast, where we build healthier lifestyles, elevate your well-being, and transform lives. Welcome to BMI.
I'm your host, Dr. Drew Crawford, a board-certified gastroenterologist and obesity medicine specialist. Thanks for joining me today on Beyond Measurements and Image. Today, we're going to discuss the obesity trends in the U.S. and touch on the global trends as well. This will be a brief podcast because, to be honest with you, it's a little mind-numbing and the numbers all start to run together very quickly. The point of the topic is for us all to see that this isn't just a personal problem, but rather a national and, in fact, a global problem. Before we delve into the trends, I want to tell you just a quick story about a little island called Nauru. So I was preparing to give a lecture on obesity a few years ago, and my son, who was in high school at the time, happened to walk by me. Now, this is my son, Houston. This is my youngest son. And he came by, and he is sort of all-knowing about maps. So I was looking at a map outlining obesity. I was a little confused on a couple of the Middle Eastern countries. It was an unlabeled map. So I just said, hey, Houston, would you mind taking a look at this for me? And, just making sure I have these countries right. So in addition to being very knowledgeable of maps, he also just has this innate ability to retain tidbits of knowledge. As we're going over the Middle Eastern map and just kind of looking at it, which surprisingly, the Middle East has a fair amount of obesity, he randomly says to me, he says, hey, Dad, have you ever heard of this little Pacific island called Nauru? He said, it actually has the highest obesity rate in the world. He's in college now. He's a physics major, actually, so he's not even into this kind of stuff. He just happened to know this, and so he told me. So I was like, yeah, not familiar with that. So I looked it up, and sure enough, Nauru, N-A-U-R-U, does in fact have the highest obesity rate in the world. It's estimated that 94.5% of Nauruians are either overweight or obese. Their average weight is about 100 kilograms, which is 220 pounds. Their average BMI is between 34 and 35, which is class 2 obesity. In addition to this, Nauru has the highest rate of diabetes worldwide. The International Diabetes Federation believes that approximately 31% of all Nauruians are diabetic. And this number is significantly higher in people aged 55 to 64. In that age group, it's estimated that approximately 45% have diabetes. The breakdown of male versus female, 97% of males are overweight or obese, and just a slightly lower number of that of the females. I don't plan to go into the causes of obesity in this podcast. What we know is that your environment really has everything to do with obesity. Nauru just serves as a nice model. What we know is that historically, Nauruians fished and gardened. Their diet was composed mainly of fish, fruits, vegetables, coconuts. And then in 1968, they gained their independence. And there was a significant economic inflow of money, which then was distributed to the citizens, which then led to an outflux of citizen labor. And then what happened was they started importing food from Western culture. And from that, you see a significant increase in the obesity rates. So at that point, they become much more reliant on processed foods that are both high in sugar and fat, and much less intake of the marine fish, the fruits, and the local available nutritional resources. Unfortunately, the land around Nauru is covered with phosphate deposits and have been majority strip mined and are non-arable. And so this really led to the need for food. And then additionally, there is a cultural thought that obesity is associated with wealth. This is just sort of a self-perpetuating situation that they've got themselves into. And then, of course, with the increase in diabetes and obesity came all of the other issues that came up, and more money went into taking care of sick people instead of preventing, which has led to a vicious cycle, which is exactly what we see in the American healthcare system, right? We really have the American Sickcare system. The way our system is set up is physicians, hospitals, clinics, they're all financially rewarded for taking care of sick people. But when you look at reimbursements from insurance companies, Medicare, Medicaid, there's very little for preventative medicine. We see that kind of coverage in pediatrics, where pediatricians are paid to help prevent medicines. But interestingly, pediatrics is one of the lowest paid specialties in medicine. So that tells you something. In this country, we just tend to take care of sick. We don't tend to push prevention. And this is what we saw in Nauru and now they're sitting at about a 94.5% obesity rate. So there's a little interesting tidbit on Nauru, thanks to my son Houston. With that being said, we're going to go over some obesity trends in the U.S. and world, and they are substantial and they really warrant addressing and thinking about. And again, the point of the lecture isn't to memorize these numbers, but to just recognize that obesity is not just a personal problem, but something that we're all in together, and we really have a lot that we need to work on, both individually and as a society. So we know that obesity rates are increasing across all states, all ages, all sexes, across race and ethnic groups, across income levels and education levels. And I'm going to discuss those just briefly on each one of those. So again, today's podcast is really not about discussing reasons or solutions for this, but just some brief overview. Is a lot of it is our environment, our nutrition and the dietary trends, the education that we've got, the social conditions, the economic conditions, limited access to affordable food, and limited access to physical activity. In Europe, a lot of streets and cities have been built around walking and bicycling. And in those cities, we do see a lower incidence of overweight and obesity. Let's go back to 2013. 2013 marked the first time that a single state had an obesity rate of 35% or more. In 2024, 23 states have a documented obesity rate greater than 35%. So in just a little over a decade, we went from one state with an obesity rate greater than 35% to nearly half of our country's states with an obesity rate of greater than 35%. Currently, the national obesity rate is 41.9%. Over 4 in 10 adults in the United States are obese. This marks a 37% increase since the year 2000. And the national youth obesity rate is 19.7, approximately 1 in 5 children. And this marks a 42% increase in obesity since the year 2000. So in 1988, 24% of adults were obese, and in 2020, 42% of adults were obese. So let's look a little bit at the state trends. The healthiest state is Colorado, with only 24.9% of their adult population being obese. The District of Columbia has a slightly improved obesity rate at only 23.5%. West Virginia, the state with the highest obesity rate at 41.2%, and Mississippi follows a close second at 40.1%. So there are 3 states that had the most significant increase in obesity rates between 2022 and 2023, and those are Alaska, Arkansas, and Oregon. So here's an interesting and kind of encouraging fact. Although no states had a statistically significant decrease in the obesity rates, there are 27 states, as well as the District of Columbia, that did have some lower rates of obesity in 2023 compared to 2022. And that's got to be due to the GLP-1 effect, right? We haven't all of a sudden begun to exercise more in those 27 states in DC. Diets haven't improved. The cost of healthy foods hasn't got cheaper, right? But GLP-1s have come on the market. So as I said before, there are now 23 states that have obesity rates greater than 35%. Colorado and the District of Columbia have rates right around the 23 to 25% range. And then the national obesity rate is 41.9%. So this seems like a big discrepancy, right? I say that there's 23 states that have rates of obesity greater than 35%. And then we have Colorado and DC kind of out there with much lower. But the national obesity rate is 41.9%. So where's the discrepancy? Well, the fact of the matter is these rates, whether they're state rates, each state reports their rate, or the national data, they come from separate surveys. And they use different methods, and they were done in different years. So the state data comes from what's called the BRFSS, which is the Behavioral Risk Factor Surveillance System. And that is all based on self-reported height and weight. And what we know is people, when they self-report their height and weight, they tend to over-report their height and under-report their weight. The national data, the data that tells us that our national obesity rate is almost 42%, that's from a study called the NHANES, which is the National Health and Nutrition Examination Survey. And that data is obtained from in-person physical examination, so that data is much more reliable. It's estimated that the state data may be off by as much as 16%. They may underestimate or underreport up to 16% of obesity rates. So let's talk about obesity trends across races. So if you look at obesity amongst all adults in the United States, as I said before, it's 41.9%. And that's evenly distributed amongst men and women, 41.9% for each sex. Now, amongst Black adults, the obesity rate is 49.9%, but there's a big discrepancy in Black men versus Black women. Black men have an obesity rate of approximately 40.4%, and Black women have an obesity rate of 57.9%. Almost 6 in 10 Black adult women are obese. Latino adults have an obesity rate of about 45.6%, and that's much more evenly distributed between men and women, with Latino men have an obesity rate of 45.2% and Latino women have an obesity rate of 45.7%. White adults have an obesity rate of 41.4%, and that's fairly evenly distributed, with 41.4% of white males being obese and 43.1% of white females. Now let's talk about the Asian population for just a minute. Only 16.1% of Asian Americans are obese, according to the BMI standard. 17.6% of Asian men and 14.5% of Asian women are obese. Amongst the Asian, the obesity rate is less than half of all the adults and less than half of any racial or ethnic group. So the question comes up is, should there be a different BMI for Asians? And the reason that's important is there are higher health risks at lower BMIs. So a specific example of this is diabetes. So oftentimes people are screened for diabetes based on their BMI. When you have such a low incidence of overweight and obesity in a population, you're less likely to test them for diabetes if you're using BMI as a screening process to go on and test for diabetes. So with that, fewer Asians are tested in the U.S. for diabetes, and it's estimated that approximately 40% of Asians with diabetes are undiagnosed. So how about education? We know that the higher the education level, the lower risk of obesity, at least to a point. We know that patients who have a bachelor's degree have a lower incidence of obesity than patients who have a high school diploma. And if you have a high school diploma in some college, you actually fall right in between. It's interesting, we'll go into a little more detail on some of the states. DC has the highest adult rate of the population with a bachelor's degree, and they also have the lowest rate of obesity. So how about income levels? Well, we know that higher income households tend to have lower rates of adult obesity as well. And then rural areas have much higher rates of obesity compared to urban. It's estimated that the obesity rate is approximately 19% higher in rural regions compared to metropolitan areas. Obesity trends and related health indicators. Let's go back and talk a little bit about this. So what we know is that West Virginia is number 1 in overweight and obesity. And they also rank first in the percentage of adults with diabetes. And they rank third in the percentage of adults who are physically inactive. And they rank third in the percentage of adults with hypertension. So the related health indicators are physical inactivity, diabetes, and hypertension. West Virginia ranks highest in overweight and obesity, and in the top 3 of all these related health indicators. Now let's compare that to Colorado and the District of Columbia. They rank 48th and 49th, respectively, in overweight and obesity. Colorado and the District of Columbia rank 47th and 49th, respectively, in adults with diabetes. And Colorado and DC rank 47th and 49th in the percentage of adults who are physically inactive. And lastly, Colorado and DC rank 49th and 47th in the percent of adults with hypertension. So these related health indicators tend to track all the way across. And remember, we talked about DC and the education levels. So your environment makes a big difference. And these related health indicators really point to the importance of getting this issue under control, not only personally, but just as a society. So let's talk a little bit about the world data. So here's an interesting fact. Approximately 41 million people on this globe die each year due to non-communicable diseases. And 5 million of those are associated with high BMIs, high BMI being greater than 25. And of those 5 million, 4 million of those deaths are from these 4 processes: diabetes, stroke, coronary artery disease, and cancer. So what we know from that is that most of the people that are living with and dying from these non-communicable diseases have a high BMI. Again, another opportunity to shine a light on the reason that we need to get body weight down. It's not just an aesthetic thing. It's not just to look better. It's for our health, our longevity, and our future. In 2025, there's 1.52 billion patients on this globe that are overweight and 1.01 billion that are obese. That marks 46% of the world's adult population. 46%, 4.6 out of 10 adults running around on this globe are overweight or obese. And in a decade, in 2035, that number is expected to rise to 1.77 billion humans overweight and 1.53 billion humans that are obese. That will make 54% of the world's adult population as overweight or obese. And lastly, and maybe most alarmingly, let's look at the world data for children. In 2025, there are 310 million overweight children and 240 million obese children. That's 28% of the world's children. And in 2035, in a decade, it's estimated that there'll be 390 million overweight children and 380 million obese children, marking 54% of the world's population. Those are the numbers on the U.S. and world obesity data. They're daunting, but I hope that hearing this, we begin to understand that although this may be a singularly personal issue, so many of us are all in this thing together, and together we can all rise above and work to lose weight. Again, not only for aesthetics, but to decrease our incidence of these non-communicable diseases and these related health indicators. I'm your host, Dr. Drew Crawford. Join me next week as we go beyond measurements and image to build healthier lifestyles and elevate your well-being on the BMI podcast. See you then. The BMI podcast is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. Be sure to check out our description below for our website and social media platforms.